Okay, hi, I'm Lynn Snyder Getz, and I'm here with Krista Keller. And Krista's business is Integrity Health Advisors. Krista, thanks for joining me this morning.
Yes.
Can you tell us a little bit about you and your business and why you do what you do?
Yes. So I have been a Medicare insurance broker. I've been in the Medicare world for about 15 years, and I help people navigate the complex world of Medicare. So anything from supplemental, Advantage, Part D, prescription plans, just the whole gamut. It's a government system that is privatized with insurance companies and very difficult to navigate. So I just help people with that.
So you're kind of like their Medicare coach?
Yeah, I guess you could say that. I start off with, for people new to Medicare, the whole sign up process of getting the Medicare started with the government and then figuring out which direction we want to go as far as insurance options go. For people who are already on Medicare and are maybe looking to switch to a plan that better suits their needs, whether it's that their doctor doesn't work with their current plan anymore, or maybe they have a new medication that they need to consider a different option that I help with choosing different options with that.
So who would be the perfect client for you?
Anybody over age 65
Okay.
or anybody who's disabled under 65 and has gone through the court system process and has been granted disability Medicare.
Okay.
Mm-hmm.
All right. Well, I just have to speak for Krista because she helped my husband and myself go through the process, and she was delightful to work with. It is daunting, and we all can't know everything. Is there any little tidbit that you'd like to throw out there that you can share with us today?
I would say definitely working with a trusted local advisor is probably the best thing to do. I mean, you can go out to the internet and try to navigate it yourself. You could read through the booklets that are sent to you in the mail or the mailers that are sent. But it's a lot of information out there. There's also a lot of solicitation out there from people who don't really know what they're talking about nationally and sometimes even internationally, I hear. And it's just nice to have somebody local that you can work with who knows doctor networks, who knows ins and outs of programs with extra benefits like dental and vision and things like that. So it's just nice to have somebody who you can trust who can navigate that for you.
Well, I have a question for you because I've just been hearing lately, open enrollment until this date, open enrollment. If I'm already on a plan
Mm-hmm.
and I'm happy with the plan, do I need to reach out to you every year and say, Krista, do we need to arrange something different? I mean, how does that work?
Good question. I mean, if you're on a plan and you're happy with it, your plan does automatically renew for the next year. So if that's just end of conversation, great news. It's easy for you. It just automatically renews. Open enrollment is a good time to take a look at all the options that are available. If you're thinking, you know what, I haven't evaluated for maybe 5 years, and maybe there is a plan that includes more dental coverage, or maybe there is a plan that would help with international travel because I'll be traveling overseas next year, that type of thing. So I would say it definitely doesn't hurt, even if you have a small inquiry that could easily be answered with, just assessing that particular category. And Medicare's annual enrollment is October 15th through December 7th. So I always tell people it is a really important time of year because it does determine what your plan will be for the following year. So whatever is chosen by December 7th would switch over for January 1. And then if you don't make that change, then your plan would automatically renew. So it is important.
So, what kinds of health things would cause somebody to reach out to you and say, Krista, I really think something's changed in our lives. I really think I need to talk to you about a new plan. What kinds of things would be triggers for that?
Oh, lots of them, honestly. I would say one of the bigger ones is I'm using my coverage more frequently. I found out I was diagnosed with a chronic condition and I'm seeing doctors more frequently. I want to just make sure that I have the best coverage. Dental has been a big issue as of late. Previously, Medicare plans didn't cover a lot with dental, which is unfortunate because we all know that dental is a very important part of our health. So it has been something over the last 5 years or so that has been more integrated into plans in some cases. So sometimes that can be a really big priority. I get a lot of calls about that. And really just any changes. Sometimes people say, I've decided that I'm going to spend half of the year now in Florida and be a snowbird between Colorado and Florida. And I just need to make sure a plan works well in both places. So just navigating and making sure they're in a plan that's the right fit for that.
So speaking about that, snowbirds in Florida half a year, if they get their Medicare through you here in Colorado, you navigate them. Is it because it's a government plan, it carries with them to Florida, or they're going to have to go to Florida and get some more insurance as well?
Good question. So wherever the person's primary residence is where we choose the plan.
Okay.
So if they're 6 months and 1 day and file taxes in Colorado, then we get a plan here in Colorado, but we do want to make sure that it works in Florida. So some plans will, some plans won't. So like more restrictive network plans here in Colorado wouldn't work well for Florida other than emergency and urgent care. Whereas for somebody who needed to see a doctor regularly, maybe needs to see their doctor once a month here and there, we would probably want to go with either Medicare as the primary because Medicare is accepted nationwide, or we would want to go with something more like a PPO with a national network. So that would be, again, just kind of deciding what plan fit would be best.
So if I'm your client and I'm moving to the East Coast, let's say, can you help me with the Medicare situation on the East Coast?
Yes, and thank you for asking. Yeah, so I'm licensed in about 30 different states. The ones that I wouldn't be are usually just because I don't have clients there or haven't had referrals there. But yeah, it's real easy for us as agents to extend our licenses elsewhere, and it is really nice again since I already have an established relationship with you to be able to just help and say, well, I know your needs and your priorities are this, and this is what would be maybe good there, whether it's staying with the same company or maybe switching to a different company that might be more regionalized there.
Well, Krista, thank you. Anything else you want to add?
Oh, not that I can think of, but yeah, I'm just glad to be able to be a resource for you all, and thank you for having me.
And if people want to get in touch with you, how do they do that?
Yeah, so my phone number is 303-921-7203. And my email is Krista, Krista, at Krista Keller, and that's Keller, just like Keller Williams, KristaKeller.net. So I'll say that one more time, Krista at KristaKeller.net.
Great. Thanks so much.
Thanks.